Wellness Waves, a podcast by Fortis Healthcare to discuss health and wellness-related topics with nationally renowned experts from Fortis. Join us on this enlightening journey and ride the waves of wellness.
Hello and welcome to this new session. I am Jennifer Chaudhary from Vaidam Health, a leading medical assistance platform. We keep bringing various health topics with senior specialists, and today's topic is heart valve replacement through TAVI, transcatheter aortic valve replacement. So whenever there's a heart surgery, patient and families are much more concerned who will be the right surgeon, how the procedure gonna take place, care, recovery, and are there any alternative to open heart surgery? Well, medical technology has made things better and comfortable for patients. TAVI has been a game changer in case of aortic valve replacement cases. Well, today we have a great opportunity to discuss this with finest intervention cardiologist, Dr. Manjinder Singh Sandhu, Principal Director and HOD, Fortis Memorial Research Institute, Gurugram. So welcome to the session. So today we'll be discussing about TAVI. My first question is that we often hear about aortic valve replacement to be done by open heart surgery. So is it possible that this aortic valve replacement without traditional surgery?
Yes, that's what the procedure TAVR or TAVI as we call it. So that's transcutaneous aortic valve replacement or implant. So in this, like we have been doing for many years, angioplasty and stenting of the heart arteries. So similarly, we have now valves which can be delivered through the catheter from your groin neck, and it just goes in non-surgically, and we implant the valve at the place of the diseased valve.
So how much is the difference between this TAVI and open heart surgery procedure time, post-surgery care and pain, and what are the benefits of TAVI?
Historically, TAVI was developed for patients who were poor surgical candidates. Because this is a disease, aortic stenosis, in which the aortic valve becomes narrowed, is a disease of the elderly. At that age, a lot of people have other comorbid conditions which preclude safe surgery. So that's how the TAVI was actually developed. So the procedure time in a conventional surgery, valve surgery, is around 3 to 4 hours, while it takes an hour to do the TAVR procedure. That's under general anesthesia. This is under local.
Local anesthesia?
Yeah, local anesthesia.
Okay.
Or mild sedation. And then we can discharge the patient the next day. He's back to his normal lifestyle immediately.
And while in open heart surgery, like
there will be a hospital stay of around 7 to 8 days, and probably a month and a half recovery time.
Is there any age barrier for this TAVI and open heart surgery cases? Like how we decided that this particular case is okay for TAVI and this case cannot go for open heart surgery, or vice versa?
That's a very good question, because there's a lot of misuse also in the procedures. Definitely, anybody above 80 should have TAVR, not surgery. Anybody less than 65 should have surgery, not TAVR.
Not TAVI, okay.
Why? Because the TAVI device's longevity is not yet known, that how long do they last. So if I put in a younger patient at 60, so he may need a second procedure at 70. That's the whole thing. Between 65 and 80 is decision making involved depending on various factors. How much is the valve calcified? What is the technical, angle of the aorta? So between 65 and 80, we decide whether a patient should undergo a TAVR or an open heart surgery, depending on other factors.
Has there been any instance that you have done a case, a TAVI, on a younger patient where it was required, and was it done like that? Because
No. So because younger patients, we will never touch and do a TAVI right away.
Okay.
Unless we have data 5-6 years down the line that the newer TAVI valves have a lifespan of around 15 plus years or 20 years, then we can start doing it at a younger age group. A lot of patients have come maybe at 55, 58 who have asked that they want a TAVI. But I convince them that that's not the right thing. So for a patient who is between above 50 and less than 65, we can tell him that you can go a surgery with a biological valve. There will be no need for blood thinners. as opposed to a mechanical valve. And number two, when this valve degenerates, it's very easy for us to do a TAVR in a patient who has had a biological valve earlier. So then we can do a TAVR.
Okay.
Because then he'll come into the
surgery, and then in case if it is required later on,
10-15 years later,
we can do TAVR.
So let's say a 55-year-old person comes. I can put him on a surgical biological valve.
Right.
And let's say 67, 68, he has degeneration of the valve. Then we do a TAVR. And then that's done.
So what are the symptoms you see in such cases where the valve replacement is required?
So typically aortic stenosis patients have three cardinal symptoms. One is chest pain, angina. Other is syncope, that is loss of consciousness on exertion. And heart failure, that is breathlessness. In aortic stenosis, there's a long period in which you do not have any symptoms. But when symptoms start, so they say if you start having chest pain, angina in an aortic stenosis patient, you have 5 years to live.
Okay.
So definitely our aim is to do surgery just at the onset of symptoms, TAVR or surgical procedure.
As we receive various international patients' report and also from the domestic as well, we should ask for particular reports that they should send so that we can decide here that patient requires valve replacement and he's a candidate for TAVI.
So ideally, the hallmark investigation is echocardiogram. So that can diagnose severity of aortic stenosis. That's all we need.
We need just echo.
We just need an echo and whether the patient has symptoms or not. And there are other tests which need to be done, but that can only be done in tertiary centers, like a TAVI protocol CT angiography.
Okay.
So which is a specialized software required in which we take the measurements of the valve, the height of the coronary arteries from the valve, because all these are into consideration which kind of valve can be used and is the patient suitable for TAVI or not. Especially ladies may have groin arteries which are less than 6 millimeters. Then it's a challenge. Then we cannot do that procedure from there.
So what should patient do if they find the recurrence of the symptoms like chest pain and the shortness of breath, dizziness after the procedure?
So that means we have to evaluate, first of all, how's the valve status, whatever procedure he has undergone, TAVR or surgical replacement. What is the functioning of the valve, the prosthetic valve which we have put? Has the valve undergone degeneration? Sometimes it can happen very quickly. And or sometimes there could be leakage from the side of the valve. We call paravalvular leakage. That can be causing the symptoms.
And again, in such cases, patient has to send, because patient has already gone to his home, the country or
no, he has to come, because from remote, only you can do only that much. So ideally, there is no alternative to having the patient sit in front of you.
They can send echo, no.
They can send the echo, but that will just sort out one aspect of the thing. And echocardiography also needs to be done by experienced people in such procedures.
Absolutely.
Not the routine echocardiograms which are being done. So it's better for the patient, if he has recurrence of symptoms, to come for full evaluation. So we can check whether it's the valve problem or it's some other problem which has started coincidentally.
So generally we talk about the success rate of TAVI cases. What, in your experience, how has been the success rate for TAVI?
I mean, touch wood, all the cases that we have done have been successful. So our success rate is 100%. Very good. But then, yes, sometimes things do happen. So I would say the success rate of TAVI is very good. It's around 95% plus is the success rate.
After TAVI, is it possible for a patient to undergo an MRI scan? Because generally
yes.
He can undergo MRI scan. Okay, sir.
Because these are usually cobalt chromium devices, not actually iron or metal.
And what activities should patient refrain after TAVI? And they should avoid doing after TAVI? That is one thing. And regarding lifestyle related so
there's no restrictions on after the TAVI procedure has been done, because you have got a normally functioning aortic valve now. So there's no restrictions as such on what activity you can do.
Any lifestyle change you suggest? Of course, like for heart patient, a healthy diet. And
I mean, see, because most of these patients have coincidentally high blood pressure, sugar. So obviously the restrictions for that, for high cholesterol, will apply for them also, but not specifically for TAVR.
So what are the most common misconceptions about TAVI?
Well, the most commonest misconception about patients is that everybody knows about stenting of the heart. that you come in, you get stent done, next day you are discharged. So they think that this is also similar. But while they should understand that there is a significant amount of pre-procedure workup involved in the TAVI. It's not like you come today, show me an angiography and say, sir, mera stent karna hai, and next day we do the stent and you are out the next day. But here we need to evaluate you significantly before the procedure. The patients expect that it is much more easier because it is being done like this than surgery, but they forget that there is an equal amount of precautions and workup needed.
So as you talk for the stay, how much a stay is required for international patient if he's coming, because he has to plan his trip for TAVI?
So ideally he should have a 2 weeks stay planned. So he comes in 2 or 3 days, 4 days we can do the pre-procedure workup.
Okay.
Then do the procedure. 2 days later we discharge him, then do a follow-up after a week, and then he goes home.
And similar for the domestic patients, like
similar for the domestic patients. Similar for the domestic patients. They should have a time frame of at least 2 weeks for the whole thing.
So do we have any instance or case where patient was advised for open heart surgery, but then he underwent TAVI as per the suggestion by you?
We had a patient who was extremely overweight. He had a body weight of around 160 kilos or so, and he was extremely obese.
Such obese.
And he had unfortunately cancer of the mouth.
Oh.
And he needed surgery to be done for that, and during evaluation he was found to have aortic stenosis. Obviously he went to the surgeon, and the surgeon refused that he's too obese and it will carry a high risk for surgery during the recovery period. And then the patient came to us, and we saw that it was a challenge to do TAVR also on him, because he had so much of fat that this much was the gap from his artery in which we have to puncture and the skin. So that was also a challenge, but we managed to do the TAVR in him with very good result, and he was discharged the next day. And he, after 15-20 days, he underwent surgery for his mouth cancer, and he's doing fine.
Between TAVI and open heart surgery, everything looks fine, like as you have told the comparison between both of the surgeries and the benefits of TAVI. But how we should address the cost part of TAVI, because the cost is high of TAVI. So
yes, see, any new technology which when it's introduced, the costs are prohibitive. But then over time, the prices come down. And already we have 2 of the valves which are being manufactured in India, and their prices are almost 40% lesser than the imported ones. Currently we can do with the Indian valves the whole procedure in 15 lakhs. And while with the top of the line imported valves, it's around 26, 27.
And like you said, the technology, as it's a new technology, so that's the reason the cost is high. But I hope the insurance that covers such TAVI procedure.
Yes, they do. They do. Provided people have insurance coverage which is of that amount. So actually a lot of people have been having very small insurance coverages of 5 lakhs, 3 lakhs, which is I think so ridiculous, because in today's day and age one should have an insurance of at least 50 lakhs to a crore, because and the premium does not differ that much.
That's important insight, so from a doctor. Yes, that you should have a wide range of
the premium
insurance.
I would say makes in a total difference of for a younger person of 10,000 a year. It will be almost, you get a coverage to 1 crore, the difference of premium.
Right. Thank you, sir, for wonderful insights about TAVI. I'm sure many of the patients would get benefit out of this discussion. Staying informed and getting right care can make all the difference for you and your loved ones. In case if you have any question, please do write to us. We shall try our best to assist you. Stay tuned with Vaidam and Fortis for more such informative sessions. Thank you very much.